Kubonakala esehla kakhulu amanani abantu abasuleleka yile ntsholongwane ye-corona kumasipala waseNelson Mandela Bay eMpuma Koloni. Kodwa nangona kunjalo abantu ababulawa yile ntsholongwane ye-corona ayonyuka kulo masipala. Lo masipala uthi nezicwangciso zokuqubisana noku.
There has been an increase, but we do have capacity in terms of our burial sites as well as our crematoriums. They are currently managing the deaths in Nelson Mandela Bay. We have enough burial space. It's only in Malabar, here in the northern areas, where we are running out of land, burial space, but we are doing an assessment to ensure that we extend that ground there so that we have more burial space.
Ebutsheni bale veki inkulu baphathiso yeliphondo ithe kuza kwenziwa uphando ngalabanani aphezulu okusuleka kwabantu kulo masipala.
Most people that were losing are people who have comorbidities. It's not just people that were losing so easy. But as we indicated in the last briefing, that we have also asked our local universities, particularly those that are also in the medical science space, to help us dig deep. We need more empirical evidence around this so that we don't just continue making it as easy as that is an issue of comorbidities.
Nomasipala waseBuffalo City uthi liqule waligangatha kwaye uthabatha amanyathelo ngokumsinga wokuqala wale ntsholongwane ukuqinisekisa ukuba kukho umhlaba owaneleyo ukungcwaba.